The advice and opinions expressed by Dr. Grandpichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grandpichet is
Dr. Doreen is an expert in autism. Doreen Grandpichet.
Dr. Grandpichet.
Dr. Doreen Grandpichet.
Dr. Doreen Grandpichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Somebody else had written in and said, I've heard about subtypes of autism. I would love to know how that is changing how kids are being treated.
I wish that kids were being treated based on their subtype. That would be a fantastic thing. So let's talk about this. This will take a little while to talk about. So there's, as part of the diagnosis of autism, you are supposed to do two things. You're supposed to identify severity levels in the two domains. So there are two sections that define autism. One is the social communication, and one is the sort of repetitive stereotypic behaviors. And so there's a severity associated with each one. So 1 to 3, 1 being the least severe and 3 being the most severe in each domain. So if you say an individual is a 1-1 severity, that means they're minimally affected in the area of social communication and in the area of repetitive stereotypical behaviors. If you say an individual is a 1-3, that means their difficulties in social communication are minimal, but they do need a lot of support in stereotypical repetitive sensory types of behaviors. Okay, so severity in itself differentiates our kids into 9 phenotypes, right? So it's 1-1, 1-2, 1-3, 2-2, 2-1, 2-3, 3-3, so there's 9 phenotypes just based on the severities. That's very, very important. And I'm pretty upset when a physician or someone diagnoses a child with one severity number, because a child who is 1-3 is extremely different from a child who is 3-1, extremely different.
Yeah.
So it's very important to get that right. That's the severity. Then there's other specifiers that we are supposed to identify when you diagnose. And there are things like with language disorder. So the individual has a lot of language issues. With intellectual disability, that means the individual's IQ is affected. With motor disability, other types of things that could possibly be going on with the child. A lot of diagnosticians leave those types of things out, and it's very important for them to try to actually put those types of specifiers in, because they help to identify the child. So assuming you have all of that, those are the ones that are identified in diagnosis. Okay, so let's say you have the severity and you have the specifiers. That already tells you a little bit about the individual, right? It tells you where they are in the social domain. It tells you where they are in terms of repetitive, ritualistic types of behaviors. And it tells you where they are when it comes to their, like, let's say, intellectual issues or their language or so on and so forth. So that's good. Then there are a whole bunch of, I guess, phenotypes that are not really defined, but we see them in practice. So there are kids who are definitely visual learners. Like, they really don't understand vocal language very well, but they have kind of figured out the world on visual cues. So with those children, obviously, it becomes very important to give them more visual instruction, because that is how they receive information from the world. So that's kind of one phenotype. There are children who have incredible photographic memories. And if you can identify those children, then obviously you use that in their treatment or in their intervention. So there's lots of different kind of phenotypes that people it hasn't been identified in the diagnostic manuals or anything, but you see those when you start working with a child, and you're like, oh, this is this type of child, and you need to teach them this way. So But unfortunately, a lot of people in treatment or who provide treatment providers don't do any of this. They don't pay attention to the diagnosis, they don't pay attention to the severity, the specifiers, they don't pay attention to the learning abilities or skills of the child. They just do a cookbook approach, which is one of the things we started talking about. And that is a big problem because for some children, a cookbook approach just doesn't work. For some children, they get frustrated and they give up very quickly. For some children, they are just, they get bored. For some children, it's too hard. There has to be modifications that are not being made. Imagine if you can't understand vocal instruction and someone is just telling you what to do. It sounds like blah, 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 right? You don't know what they're saying. So it just becomes aversive. It's very, very, those are the things I was talking about earlier, Shannon, when I was saying the portion about an individualized has to do with how you teach. And really how you all of that has to do with the child.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.